I'm Linda Booker, and I will be performing 3 scenarios for the first aid class. My first scenario is going to be making dinner, and the scenario reads as such: in a small cramped kitchen, you and some friends are preparing a spaghetti dinner. The water is boiling and the pasta is now ready to be carried to the sink and drained. You pick up the pot of bubbling pasta, water, and start in the direction of the sink. The pot holder slips slightly, causing the water to splash on your arm. The scalding water burns your forearm. You are experiencing a lot of pain with red blistering burns on your arm. What are the appropriate first responses? This is going to be my patient, Miss Angela. In this case, what we would do is, of course, we would put the pot down away from her. Then we're going to bring her over to the sink, and we're immediately going to turn on cold water. We are going to be relieving the heat in the burn by placing the cool water on her arm. We never want to put any ice or ointment, butter, anything like that on the arm, just cool water. Then we will have to put a cool compress on this so that it continues to draw the heat away from the burned area. And also, I just want to say that we have already dialed 911 because we have determined that this burn is larger than 3 inches in diameter, so that would be considered a 2nd or 3rd degree burn. So these procedures will help us so that she experiences less pain, but also gets her ready for the next care of action. All right, so that's scenario 1. Scenario 2, we are going to be at the tennis court playing tennis. You're playing tennis with your friend. You hear an older man on the court next to you say that he hasn't played tennis in quite a while. He says his left arm and shoulder are a bit sore. He suddenly grabs his chest and he stubbornly says he will continue as soon as this passes. You go over to help him, and when you ask him to lie down in the shade, he refuses because he says he feels nauseous. What are your next actions as a first responder? As a first responder, when we see somebody in this type of situation, what we want to do is we want to ask somebody to call 911 right away. Secondly, we're going to ask someone to go and get the AED. In most parks now, they have AEDs that are located near the restrooms, so we would ask them and advise them accordingly. Then I'm going to say that if the patient refuses help, we cannot force ourselves on the patient, but if he does succumb to his disability, then what we would do at that, or his symptoms rather, what we would do at that point is ease him to the ground, help him with his symptoms. And so if I could, I'm just going to have you sit down on the ground, please. And we're going to have, oh, honey, I'm sorry. We're just going to have you sit down. I'm going to stay with the patient at this point, giving trying to keep him calm. We're not going to allow any food or water to the patient, and then we're going to be waiting for 911 to arrive. I'm staying with the patient to make sure that he doesn't have any further cardiac events or that he does not pass out. So as soon as the emergency care gets there, then they would resume medical assisting at that point. So, thank you. All right, in our third scenario, this one is going to be bug repellent. And we're outside with a friend and the mosquitoes are really biting. You decide to help each other out and spray insect repellent on each other. You accidentally spray the repellent in the other's eyes. Ouch, yells the victim. And what is the appropriate response? And at this point, we're outside. If we are still close to a place where we can get fresh water in a sink, we want to get there immediately and begin flushing the patient's eyes out as soon as possible. And then also we would want to pick up the bug repellent. We want to locate the 800 number on there for if there's any poisoning or anything, we can call them right away to ask advice for further assistance. And I'm not going to put water in your eyes. But if we are outside, we don't have access to fresh water in a sink, then of course we would want to take bottled water and resume flushing the patient's eyes as soon as possible. So, but assuming we do have access to a sink, again, we would remove the patient's glasses. We would immediately start rinsing the patient's eye so that we could ensure that we're getting any and all residual of the bug spray out of her eye. So that is my 3 scenarios, and thank you so much.